Hello everyone, welcome to the session on simplifying ICD 10 coding guidelines. Today we will be diving into the ICD coding guidelines specifically for COVID-19 cases. In this session, we will be exploring various patient scenarios to illustrate how to accurately code different situations. The first scenario is for confirmed diagnosis for COVID-19. Jane, a 35-year-old patient, presents with symptoms like fever, cough and body ache. And on the doctor's advice, he was tested for COVID-19. The test results came positive. So in this case, the ICD codes that will be assigned are U07 for a confirmed COVID diagnosis, and as the ICD coding guidelines suggest that for COVID cases, we need to assign symptom codes as well. So in this case, the additional codes will be for fever R50.9 and recently developed cough, that is acute cough, R0.1. Second scenario is for a asymptomatic positive test. Mark, a 28-year-old, comes in for a routine checkup and tests positive for COVID-19, but he has no symptoms of COVID. So in this case, the ICD code that will be given here will be just U07.1 for a confirmed COVID-19 diagnosis. Third scenario is for a patient who is exposed to COVID but shows no symptoms. Sarah, a 45-year-old, has been exposed to a confirmed COVID-19 case and reports no symptoms. So in this case, we will assign the ICD codes Z20.822. But if Sarah is screened for COVID-19 and tests positive for the test, then we will assign the code U07.9. Fourth diagnosis is for an additional diagnosis with COVID-19. Liam, a 10-year-old patient who had COVID 2 weeks ago and now shows symptoms of multisystem inflammatory syndrome. So the provider's diagnosis for this visit is MIS due to prior COVID-19 infection. So in this scenario, our principal diagnosis will be U07.1 and our additional diagnosis will be M35.81 for MIS. Next, the fifth scenario is for a post-COVID-19 condition. Emma, a 50-year-old, follow-up for after recovering from COVID-19 but continues to experience fatigue. So the provider diagnosis in this case is history of COVID-19 with ongoing symptoms. So in this case, our principal diagnosis will be U09.9, which is for post-COVID-19 condition, and to report that post-COVID-19 condition, our additional code will be R53.83, which is for fatigue, as the patient is still suffering from the post-COVID symptoms. And our last scenario is of a screening case. Tom, a 32-year-old, is undergoing pre-operative screening for COVID-19. So for a visit for screening of COVID-19, we will assign the ICD code Z11.52, which is a description for encounter for screening for COVID-19. So these were some scenarios on COVID-19 reporting. Hope you were able to understand the scenarios. We will be back with new scenarios on new coding guidelines. So subscribe now for upcoming sessions. Thank you.